And now I will turn it over to Liz.
Hi, everyone. Thank you for joining today's webinar. We wanted to gather everybody around this Lifeline topic, not only to give you, because I know some folks are joining because they want to learn more about Lifeline and how to get their clients connected. So I'll touch on that in the beginning before I turn it over to our guest presenter today, Olivia Wine, who's a telecom genius and works for the National Consumer Law Center. So I will send it over to her, but first I wanted to just make sure that everybody is on the same page about what Lifeline can provide. And in Pennsylvania, we have some specific programs, but Lifeline in general is a federal program available to anybody who's below 135% of the poverty level or who's participating in some different programs that are basically automatic qualifiers. And we'll go through what those programs are. They're like SNAP, Medicaid, SSI, housing assistance, and veterans assistance. There is a slide in a little bit about how to verify income, but basically if you're below 135% of the poverty guidelines, you can participate in Lifeline. And what Lifeline provides is a $9.25 discount per month on either a voice line, so a home phone line, a wireless line, or a broadband service. So they can choose one of those three to apply it to. And who the providers are for that is one of the big questions that the SBC is currently looking at in a rulemaking, and how the changes to that happen are going to be of significant consequence to Pennsylvania, and Olivia will talk more about that in a few minutes. But before we get into that, I wanted to mention that there are two other complements to Lifeline in Pennsylvania for Verizon customers only. One is there's a program you might know of called Lifeline 100. This is offered, like I said, only for Verizon customers in Pennsylvania, but it provides in a bit more of a discount. So instead of the $9.25 you would get as a monthly discount through Lifeline, you would get a discount of $11.75 per month. And that's if you're below 100% of the poverty guidelines and you're a Verizon customer. The other Pennsylvania-specific telephone program is also a Verizon program, and it's called UTAP, the Universal Telephone Assistance Program. It's a grant assistance program. It's administered by the Dollar Energy Fund, which many of you in the western part of the state are probably very familiar with, because Dollar Energy administers a lot of our utility assistance programs. This grant assistance program can be used for Verizon customers who are facing a hardship in paying their bills. There aren't really parameters on how much that grant can be, and we have had a recent case anyway, where we had a real difficult time getting the client through the UTAP program. The Verizon the call center didn't even seem to really know about the program, so we did have a lot of back and forth. If you end up with a client who could benefit from UTAP grant assistance and you're having trouble getting them connected with Dollar Energy and getting a grant to go through, let us know, and that may be something that we at the Pennsylvania Utility Law Project can help with. So that's a nutshell of Lifeline, and then the two specific Lifeline 100 and UTAP programs in Pennsylvania. And I'm going to now turn it over to Olivia Wine, who will be able to, she's going to talk a lot more about Lifeline modernization, which happened in 2016, and then some about what this rulemaking that I mentioned earlier is going to do, particularly to the providers of Lifeline in Pennsylvania and what that means for our clients. And then we'll close and talk about some of the advocacy pieces that we've put together. As Kelly mentioned, there's a copy of your PowerPoint in the chat box, as well as a draft op-ed and a fact sheet and some talking points We'll go through all those points in the webinar, but then I want you to know they're there, and we'll talk about how you can use those to do some advocacy both locally and hopefully in joint effort with us at the Utility Law Project. So without further ado, I'll turn it over to Olivia, who I'm so happy to have with us today.
Thanks, Liz. Again, Olivia Wine with the National Consumer Law Center, and this is kind of a long slide deck, but I'm not going to go through all of the slides in great detail, but just to let you know, you will have this as a resource later, since it does have some useful information about eligibility criteria and just what the minimum standards are for Lifeline service, so you know what the products will look like. Starting off with some overall context. Oh dear, I'm trying to get my life control. Okay, thank you. Lifeline is one of 4 federal universal service programs, so I don't even know if folks are aware, but there is about $8 to $9 billion spent annually a year on universal services. Used to be voice connectivity, now it's pivoted to broadband. So it's voice and broadband. Lifeline, these are just letters up here, but Lifeline is that orange wedge of the pie. It's less than 20% of these federal dollars is going to the Lifeline program. A quarter of the pie goes to broadband for schools and libraries. Over half of the pie goes to broadband networks in rural and hard-to-serve areas, about $4.5 billion annually. And then rural healthcare, the telemedicine, is a very small wedge of the pie. It was about less than $300 million in 2015. It's a little bit bigger now, but it's still a very small wedge. Which is just to say Lifeline, again, is the only of the 4 universal service programs that focuses on helping low-income households afford modern telecommunications services. The rest go to broadband networks. So, as Liz mentioned, this program has undergone a recent modernization in 2016. It was originally designed as a voice support service, and that may be the program many of you are more familiar with, when Lifeline provided a discount off of the Verizon type of local phone service. It's evolved substantially since those days, and in 2016 it included broadband internet access as a supported service. So right now consumers can choose to apply their Lifeline $9.25 discount to voice, broadband, or a bundle, like a voice data bundle on a smartphone. The modernization order also changes how consumers apply for Lifeline. In Pennsylvania, it's not going to change right away, but within the next couple of years, that process will be switching to a national process. It'll be a national eligibility verifier process as opposed to the utilities taking the application. The next sheet is probably the most useful. It's how are you eligible? So in addition to the 135% of poverty that Liz talked about, if your clients participate in SNAP, SSI, Medicaid, federal public housing assistance, Veterans Pension and Survivors Benefits Program, some of the tribal assistance programs, they're automatically eligible for Lifeline. So that streamlines their on-ramp to the Lifeline benefit. When consumers sign up for Lifeline, right now in Pennsylvania, it will probably be the phone company or the Lifeline service provider that will go through this sign up. But there are a couple of things. They're going to ask for a lot of data because they've got to do an identity authentication check, a duplicates check to make sure that the client doesn't already have a Lifeline account. They're going to do an eligibility determination, for example, if they're coming in through SNAP, to make sure that they're actually in SNAP. And this check, right, as I mentioned before, will be phasing over in a couple of years in Pennsylvania to a national verifier, which will essentially be an agent of the Universal Service Administrative Company, but we'll cross that bridge when we get there. So just right now, keep in mind that a lot of data will be collected because the federal rules require these fraud, waste, and abuse types of checks.
And Olivia, I'll just chime in that Pennsylvania, and some folks on the call do a lot of work with the Pennsylvania Department of Human Services, who does have a web portal open to providers where I believe that it went live in the last couple of months so that the providers can check with them on enrollment in some of these programs. But they're still working on getting, advancing as far as meeting the verifier standards.
Right. That is excellent because that should speed up the process for the eligibility determination. And essentially what will happen when it phases over to the national process is the national verifier will step in the place of the carrier. I think in the long run, that's a good move in terms of privacy protections for the consumers, so their personal information and this sensitive information isn't reviewed by a private entity, but again, the national verifier will be an agent of the Federal Communications Commission, so it will be like a federal agency's agent handling the enrollment. So it'll work more like the other, I think, benefits programs.
The other thing I did want to just mention for folks, because they'll be not only to help them through the what happens after you sign up, but if you're looking for more information about the program or what providers might be providing Lifeline options in your area, you can go to usac.org, and that has a lot of information about how what's available in your area, what the contact information of those providers are. So those on the front lines who really need more about how to get through the door, that's a door you can go through.
Absolutely. There's a tool that they just created that went online called a zip code locator. So if you type in the zip code that your client lives in, it should pull up the participating service providers in the Lifeline program. So you'll know what the choices are. The next slide is just sort of the timeline. At the end of this year, half of the states should be transitioning over to this national process. By the end of next year, all of the states will be using sort of the national process as opposed to going through the carrier to do the eligibility determination. In terms of who can provide the Lifeline service, it's not just any provider. They have to be approved either by the State Public Utility Commission or the Federal Communications Commission. And there's a term of art called Eligible Telecommunications Carrier, or ETC. So they have to be an ETC to participate and receive that federal subsidy. This is the web link to the zip code locator tool that Liz and I were talking about. That's the USAC link. So just realize it's in the slide deck for you. There's some additional features that are part of the Lifeline program because it's a federal program. There are minimum standards for the product, for the voice. For example, if it is a Lifeline voice service, right now it must provide at least 750 minutes if it's, and that will go up in time. Next year, by next December, it has to increase to 1,000 minutes a month. Right now, it's 750 minutes a month at a minimum. If they're getting mobile broadband, for example, the minimum standards are a 3G product and 1 gig of data. Again, these minimum standards are reviewed by the FCC staff every year, and they're starting a gradual ramp up. So they started very modest, with very modest standards to preserve a marketplace. But the notion is that within every year, these standards will tighten up. So soon we'll be at the point where these are comparable to the products that everyday users use, the average user uses their the way the average users use their communication services, the number of minutes, the amount of data, and such. Aggregation, the second feature, is this ability, for example, if you are a public housing authority and you would like to bundle your tenants, aggregate them, and negotiate a deal with a broadband service provider, let's say, and say, for a particular service, you can negotiate additional above minimum standards things, like maybe include trainings, include equipment, include modems in the units, that type of deal. Those type of bundling deals will help leverage that Lifeline benefit. That is possible through this new Lifeline program. There's a Wi-Fi and tethering requirement, so that the Lifeline benefit only covers, it's a discount on the service. It doesn't pay for any equipment. That's why you have to negotiate that in an aggregation deal. But also, if, for example, with these sort of free Lifeline products that are mobile phones, they're probably smartphones, if the carrier provides a phone, a free phone, as part of their Lifeline package, that phone must have Wi-Fi capability, and the tethering, and have tethering capability. I can talk about that later if you're interested. I'll just put a star there. The other thing is a port freeze, but we'll talk about the port freeze later. That's the ability of a Lifeline consumer to change carriers at any point in time, to shop with their feet. Just realize that this page is there. This is sort of a layout of the minimum standards for the different Lifeline types of products. There's mobile voice, mobile broadband, fixed broadband. The last two columns are the amount of reimbursement the carriers get. The only thing I'll point you to right now, as of the 2016 order, voice support phases down. I will talk about this later. This is now live. We can say voice service as a supported service in this proceeding. Maybe the one small silver lining. A little bit more about the aggregation. If you're interested, let me know. We could talk more about this, but it's just, think of aggregation as the ability to leverage Lifeline benefit for subscribers. There's a squiggle on my screen. It's not me. I don't know where it's coming from. I apologize. A little bit more about the Wi-Fi and the tethering, which I talked about. The port freeze. In the past, or actually right now, this is gone. It used to be if you got a Lifeline broadband product, you couldn't switch carriers for a full year. The FCC got rid of that requirement in November. So basically realize that your customers can shop around. If they signed up for a Lifeline service product, they don't like it, they're free to shop around and pick another provider. Use the zip code locator, find another service to sign up. Here's where things are different. So these are the things that are up in play. Right now, the most common Lifeline product, the most popular product, is the free phone. It's basically these providers, these Lifeline providers, have figured out a business plan where they can offer a free handset, and then the Lifeline benefit provides the regular free minutes or minutes and data bundles every month. They're just automatically loaded onto the phone. So it's a very helpful product. You don't need to pay a deposit. You don't need to pass a credit check. You just need to be eligible for that Lifeline product. This notice of proposed rulemaking, the FCC wants to basically eliminate the providers of those free products by, I wouldn't say they're attacking the free products necessarily, but they're They're going after a particular type of carrier. They're wireless resellers that don't own their own facilities. And in Pennsylvania, those providers happen to serve over 75% of the existing Lifeline marketplace. So if this rule does go into effect, it will disrupt the marketplace. These Lifeline households are going to have to find another provider, and it's entirely possible that they may not be able to find another provider. Liz, did you want to sort of touch on what you were looking at?
Yeah, so we have been using the zip code locator that we mentioned earlier across Pennsylvania, and we're finding that in many areas, and this doesn't mean that service is not available, but at least it's not coming up as available. There are no options apart from these non-facilities-based wireless providers in large swaths of both urban and suburban and rural Pennsylvania. So we're finding a lot of these areas have like 2 wireless options that they can go with to apply their Lifeline benefit. But you know, if they were to want if the ability to apply your Lifeline discount to these non-facilities-based wireless providers, and we're talking like Assurance Wireless and Blue Jay Wireless and TracFone. They're the really big providers that I'm sure a lot of your clients have their Lifeline benefits from. They'll be forced to go back to facilities-based providers, and quite frankly, a lot of our clients probably have old debt with them, and there's because the telecom industry is no longer really regulated in Pennsylvania. These facilities-based providers have a lot less pricing controls and a lot fewer consumer protections. So if they're forced to go to these facilities-based providers in order to apply their Lifeline discount, basically like taking their Lifeline discount away, because they won't be able to use it for services that don't require, you know, upfront security deposits and things like that.
In Pennsylvania, just a quick look, actually it's 85% of the current Lifeline recipients are receiving service from these non-facilities-based providers, and less than 4% are receiving from the sort of traditional landline. And then there's a small subsection of wireless carriers that do own their own facilities. But there's a big open question about if you take away these resellers, the TracFones, the Blue Jay Wireless, there is no guarantee that there is another service available for those recipients. And sort of the rationale as to why, when you go back to that first slide where I talk about, you know, over 3/4 of that pie right now of $8 to $9 billion annually in federal universal service funding going to support broadband networks, and only Lifeline focusing on the households and their affordability barrier. The FCC's rationale is they would like to turn Lifeline's focus away from low-income households to network infrastructure. They want to incentivize the build-out of networks. I mean, that's what they're saying. There's no guarantee that even this sort of pivot would make that happen. But what's really a shame is that, as I said, this is the only program that focuses on helping low-income households pay for phone service. And if we lose it, there's no guarantee that we will ever sort of build back something that can address that problem. So we really need folks to engage and push back hard to say to the FCC, keep the focus of Lifeline on people and not the networks. They're already dedicating several billions of dollars a year on the network. Focus those programs on that problem, keep Lifeline on the affordability problem. Another proposal or series of proposals in this notice of proposed rulemaking would ration Lifeline. They're proposing a budget cap. Right now, Lifeline is a very unusual program. It's not subject to federal appropriations. It's paid for by all the users of telecommunications services. On your phone bills, you'll see a universal service charge that goes into that large multi-billion-dollar pot of money for the 4 universal service programs. Right now, every household that qualifies for Lifeline is entitled to Lifeline. They can get it. There's no limit. The FCC would like to cap the program, and some of their proposed numbers would be a draconian cap. It would be so low that they would need to create some type of waiting list system. They would need to create some type of prioritization system of how they would rank who would get a Lifeline benefit, because it becomes very scarce. Their draft proposed prioritization would put rural communities over urban communities if there was any money left over. This is, again, sort of to bring it back to that point, Lifeline is focused on helping low-income households throughout the nation, regardless of where they live, afford modern telecommunication services. That's the point of universal service and universal connectivity. So we'd like to remind the FCC that that's very important, and they shouldn't lose sight of that. They're also proposing something called a lifetime benefit cap. They feel like the gist of the proposal is this, that Lifeline consumers would sort of appreciate the benefit more if it wasn't sort of unlimited. So that maybe if they cap it over a person's lifetime, they'll think twice about signing up to make sure that they actually need it. It's very insulting, it's very upsetting, and it's also very inefficient. Like, they would essentially need a database that would track people for their whole life. Because if they receive Lifeline when they're you know, a young adult trying to get a job in the marketplace and pull the, you know, get housing, and then maybe when they're a senior and they need Lifeline again, maybe they've exhausted their benefit amount. It's absolutely, it's so hard for me to stay calm when I think about that issue. But I just want to let you know that that's sort of the nature of the types of proposals that are in this notice of proposed rulemaking. It is pretty hostile to the existing Lifeline program. It is pretty unaware of the realities of what it's like to be poor, to need a Lifeline phone, to get housing, to access health care, to pick up extra shifts, to apply for a job, just any sort of, you know, modern engagement in society. That type of connectivity is so important, and yet they're treating it like it's not a necessity. So there is a plea for folks to engage, to get their stories on the record, because as I'm trying to sort of summarize for you, the nature of this notice of proposed rulemaking is tone deaf. It's very tone deaf to the fact patterns that you see every day, and to why Lifeline is so important to our clients. Another proposal is they would eliminate that sort of free phone model where the carriers provide the free handset and automatically upload every month the you know, what, 750 minutes or, you know, minutes and data, and the consumers basically don't pay. They would like to require a copay. Again, it's sort of their rationale is maybe consumers would appreciate the Lifeline benefit more if they had so-called skin in the game. Again, it's very insulting. It's not sort of realizing how this type of Lifeline product actually helps a lot of vulnerable consumers. It's in there.
Olivia, we have, before we go to the advocacy slide, we do have a question. Zachary asked if there are any markets that do offer broadband in Pennsylvania. Using the zip code tool, I've only found home phone and mobile. Which I think is a good point. I'd like to hear your perspective, because I share Zachary's frustration that we're finding the very same thing when we look across Pennsylvania, that very few areas have any broadband.
Right. So the 2016 modernization order allowed for broadband to enter the marketplace, and it also created a streamlined process for internet service providers to become Lifeline providers. They made it a federal process, so they preempted states from doing the designation for a Lifeline broadband provider. I didn't go into this. This was to help grow a marketplace. One of the first things that happened, and this was sort of tied in with the aggregation proposal. So there were 9 Lifeline broadband providers that had been approved to sort of enter this space to create these innovative broadband, affordable broadband products. But then we had an election and a new FCC. And this new chairman, one of the first things he did at the start of the year was he yanked back those first 9 Lifeline broadband provider designations, and he basically put a halt to the entry of that affordable broadband product. It is one of the issues that's live in this notice of proposed rulemaking. So it's a little bit complicated, but there's some things that we need to happen to help sort of foster this marketplace, but the Lifeline program in the 2016 order was structured in such a way to let that marketplace evolve, to grow and evolve. So that's why you're not finding them. Right now, the broadband is mostly through the smartphone product, the wireless broadband, which is a much more modest type of product by a lot. But, and then, the aggregation piece would be a way to sort of get that home broadband, a more robust broadband product to our clients. It involves sort of more, of a community organizing sort of package and pitch to a broadband internet service provider who's willing to become an ETC, an eligible telecommunications carrier, through whatever process the FCC decides. Right now, we're in an odd place because the FCC chairman at the start of the year basically put a halt to the Lifeline broadband provider designation process. There is no way for a broadband provider to sort of get approval, because right now, according to the 2016 rule, states are preempted, and the FCC is saying we're not going to do it. So right now, there is no federal or state entity that can approve a Lifeline broadband provider. A very long answer to say yes. We're very frustrated because we were hoping to grow this marketplace, and there were carriers that were willing to jump in. The other thing they're waiting to happen is for this national verifier to come online so that they would not be responsible for doing the eligibility determinations. That was sort of one of their barriers to entry in the marketplace. And as I showed in that earlier slide deck, the national verifier process is underway, and it's rolling through. So that part of the puzzle will be taken care of. Hopefully soon, we'll get some clarity as to the process for broadband to enter the marketplace. It'll probably be on a state-by-state designation level, so keep your eyes tuned in Pennsylvania. And then hopefully then when you use a zip code locator, you'll be able to find some carriers.
And I think, and Olivia, correct me if I'm wrong, but that doesn't, what Olivia is saying about entry into the market to offer broadband, affordable broadband service, I do think that Verizon at least has a tariff that allows it to apply the Lifeline discount towards a package that includes broadband. That can be very, very costly. So it's effectively, I mean, for a low-income consumer, paying for a $100 package and getting a $9.25 discount is not really what we mean by, you know, access to broadband. But Olivia, correct me if that's wrong. I had seen that tariff just the other day and thought that they were providing the Lifeline discount, or at least allowing it to be applied. But I think that's only in areas where FiOS has been deployed, which would only be urban areas.
Right, that's correct. So if you have a sort of a traditional phone company that's moved into fiber, like Verizon with FiOS, yes, you may see those packages. They're just, as you said, so unaffordable that they're not part of what I consider like the true affordable broadband pieces. That's the marketplace we were hoping to grow.
And that, I think, really sums up what the problem is with the switch to facilities-based is you'd be forcing people to go back to these providers that may accept the discount, may happily take the $9.25 from the federal government and offer you an $80 package, a $50 package, you know, with just a small discount applied. So, you know, if we were to shift fully to facilities-based, then that's, I think, what you're going to start seeing for everybody who's trying to access, you know, a Lifeline discount product.
So the overall strategy, I mean, I hope that I've conveyed sort of the horror that's in this NPRM. I think it really is going to destabilize the Lifeline program if these proposals do become adopted. I do think we have a chance to push back. I think that I don't think that a lot of industry is really supportive of this. Actually, I think they're more than happy to let sort of a niche marketplace take care of Lifeline. It really does seem to be coming from a more political bent and a philosophy about anti-poverty programs. So our hope is that we can sort of preserve the Lifeline program to fight another day. Just really continue the 2016 modernization order transformation, just allow it to, you know, evolve and avoid a cap. And so on this last slide, we have outlined some different areas that we would really encourage folks, if you have the capacity, to speak up, especially those who are representing some of the populations that will certainly feel a bigger impact as a result of changes to Lifeline. You know, victims of domestic violence in particular, which I've spent many of years of my life working with, and I know many of you have as well. You know, not being able to access a wireless phone service is going to do some damage to the ability to access 911. It's going to do damage to homeless populations who are trying to get their feet underneath them, veterans groups, really anybody who's out there working with clients. I know we can all relate to being able to get in touch with our clients pretty easily in one part of the month, and then you know, not hearing from them from 2 weeks, and when they pop back online, it's, you know, well, I ran out of minutes. So if you can relate to that, chances are it's your client accessing their only access to telecommunications services is through this Lifeline program. So it's really important that we all kind of step in and try and present a voice for our clients. So with that, comments are due like really soon. January 24th is the comment deadline to the FCC on some of these changes. Reply comments due February 23rd. We at Pulse, on behalf of our clients at Cause PA, are going to be filing some comments. We're putting together
comments, and we would love to have all of you join in those comments. So I'm drafting them as joint comments, and I'd love us to be able to present a unified front from Pennsylvania. It'll talk about some of the impacts in particular, but I encourage anyone with the capacity to also file their own comments with the FCC about their population. And then, Olivia, I'm not sure about the ex parte opportunities. I just don't practice before the FCC, so maybe you could talk about what that opportunity is.
Sure. The FCC actually is kind of friendly to input, believe it or not. It's very easy to write a letter to the FCC about a particular issue in a docket that's open, even outside of the official comment deadlines. And you just make sure when you go through the click-through menu that when you say what type of filing it is, you just say ex parte, and it goes into the record. So ex parte opportunities, so for letters or just wanting to file anything else into the record, you can do that all the way up to 1 week before the FCC votes on an order. It's called Sunshine. If you need help doing it, we will be sending out some information on how to file at the FCC later. We're going to prepare that instruction sort of sheet. Hopefully just make it's fairly straightforward once you understand the website.
Awesome. Yeah, and you had mentioned you'll put together some kind of guidance, so we'll be sure if that gets put together to get that out to you folks. We have everyone's email that's participating in the presentation, so we'll make sure that goes out. The other thing I do want to note is that we would absolutely love to be able to highlight some client stories in the joint comments that we're putting together on behalf of our clients. We already have a few, but just one or two direct client stories. It is absolutely fine if we need to, redact names or, withhold any facts that might, disclose confidential communications. We're not after doing that, but hearing the human stories is going to be really important for the FCC and, quite frankly, for members of the Pennsylvania delegation. So that's the other part. If you all who are on this call have contact either, I think, with your state legislators or the Pennsylvania delegation to the federal lawmakers, it's really important that you contact them, tell them that this is a concern so we can put some pressure on the FCC. We also, the awesome folks at NCLC drafted up a sample op-ed that was in your chat box when we started. So if you scroll up in that chat box, you should be able to download it, but we'll also email it after the fact. If you're interested in submitting an op-ed, there's a draft to go from. If you've got your own connections, that's great. But Olivia, I think you mentioned that you have some outstanding communication folks that may help with placement too. Is that right?
Absolutely, absolutely. Just let us know if you need help placing it.
Awesome. So we'd love to help you work on that if you want to, if you need assistance with specific facts. But I think the sample is really, really good. So feel free to adopt that, add your own stories, or, information about your own program, and get out there with the message. Also included is a petition that the Free Press, I think is it Free Press Association that put that together?
Free Press, yes. It is for individuals. But organizations, I guess, can sign it too. There will be an organization. There are organizational opportunities being created. So more things to come in your email.
Right. And so there will, if you don't want to join our Pennsylvania comments, there are some higher level national comments for organizations that are being drafted as we speak. and we'll certainly send that around, though we encourage you all to join with us in signing on to our comments. But there's no reason you can't sign on to multiple things. And of course, as an individual, that petition is a way that you can use your voice outside of your capacity in your organization. So, you know, I can't say enough how much we need a unified voice on this. This is about, you know, really essential services here for our community. I don't see any questions coming in. Is that a new? No, that was the same one. Does anybody have any questions? If so, please put it in your chat box, and we should be able to answer. Okay. With that, I think, Olivia, did you have anything else to add before we close?
Just wanted to say that our contact information is at the end of the slide deck, and please call, email if you have any questions, and I'm happy to talk and help. Thank you.
Awesome, and thanks to Olivia. You've been a tremendous help getting Pulp up to speed on these issues so that we can bring it out to all of our networks. And again, folks, don't hesitate to call us if you have an idea or you just want to make sure you're in on everything. I will be sending around draft comments for sign-on from Pennsylvania early next week, you know, probably Tuesday, Wednesday at the latest, but I'm hoping to get them out the door by Tuesday evening. So we'd love it if you could sign on, or if you've got other agencies you work with who might be able to sign on, who are doing some direct service work or individual clients. And again, we really could use your stories. So if you've got any clients you're working with and you think their story is compelling about their access to telecommunications and broadband, please, you know, share. So thank you all for attending our webinar. Thanks to the Utility Law Group for sponsoring it. Thanks to Plan for being our administrators, and of course, thank you again to Olivia for all of your time and input. I will give you back the rest of your day. Have a great one.